Hi everyone, I am Dr. Sakshi Khandelwal, a first year PG resident in dermatology at SMS Medical College. I got an AIR of 502 in NEET PG 2024, and since this year's NEET PG, a lot of you guys must be confused as to what branch should you take. A lot of my juniors have also called me regarding derma. So here I'll be telling you all the reasons as to why I took derma and the pros and cons I feel this branch has, which I have encountered till now. Okay, to start with, I would like to confess that it wasn't like derma was my dream branch from day one. Rather, I was just studying with the thought that I should have a rank with which I'm able to have everything, right? So once I got the rank, that is when I started exploring all the options which were fitting certain criteria which I had set for my branch. And derma mostly fulfilled those criteria, so that is why I ended up opting for derma. Okay, so the first criteria I was having was that I wanted a branch with which I could have a good work-life balance. Like that was non-negotiable for me. I wanted 8 hours of sleep every day. I wanted to have a life outside of hospital also. But again, this is like a pro for me that derma lets you have a lot of free time to yourself. But this is not true for everyone. Like I do have friends who would come and say कि अरे यार साक्षी तो 2 बजे के बाद करती क्या है, right? So that is when I tell them कि okay, I do spend my time on other things as well. The another criteria was that I wanted an end branch, and why is it so? Because not because I don't like studying, but it is because I genuinely wanted to break free from the whole coaching, GTs, and exam wala cycle. Like I had given NEET UG, NEET PG, and I did not want to give NEET SS. Okay, and there's a reason behind it why why I did not want to. It's because that whenever I have to give like this major exam in my life, everything else in my life comes to a halt. Okay, so like my personal life, it sort of becomes dead. I will not take out time to exercise. I'll not take out time for my hobbies. So that is the reason why I did not want to take a branch जहाँ पर NEET SS is sort of a mandate, especially in tier 1 and tier 2 cities. Okay, so like I live in Jaipur. Here, if you are taking general medicine or general surgery, it is sort of a mandate that you will have to give NEET SS also. Okay, but if you are someone who comes from a tier 3 city, or you want to settle in a tier 3 city where like a general medicine doctor or a general surgeon is also rare to find, then of course वहाँ आपको NEET SS देने की necessity या mandate नहीं होगा, right? But in my case, I just wanted a branch where there's simply no option of NEET SS. So the next criteria was that I wanted to have a clinical branch. Like it wasn't really a necessity for me, but I was inclined more towards clinical branches as compared to non-clinical branches. Plus, it is a clinical branch which will not have a lot of emergency. So that is something I love about derma, right? Because I am like a type B personality. I cannot handle a lot of emergencies every day. But it also varies from person to person. Okay, like it's a pro for me, but it can be a con for someone else also, because the same emergencies which would give like a adrenaline rush to a hustler would end up giving me panic attack. Okay, so that's why I did not want a branch with a lot of emergencies. I wanted a branch where I could sit back, relax, and think about the diagnosis and then make a treatment. Okay. But like 7 months into the residency, I have realized that it's not something which is free of its own disadvantages. These are not really disadvantages, but yes, if you are considering of taking dermatology, then you should be aware of these facts also. Okay, so firstly, it's not an all glamorous branch as being portrayed by the Instagram dermatologists. Like please don't forget the two other pillars of dermatology, that is venereology and leprosy. Yes, leprosy is nowhere eliminated from India. Like I the day I joined dermatology, I realized that that was the biggest myth we have been taught in PSM, because it's nowhere eliminated. It's pretty much prevalent, especially in the northern parts like Rajasthan, UP, Bihar. इस side पे बहुत ज़्यादा prevalent है, and so you will get to see a lot of leprosy patients, and you will have to see a lot of STD patients also. Okay, so now this is not something. So like after 7 months I have become quite used to the whole genitalia examination wala part. Like I only focus on the, my eyes just focus on the pathology now. But I do remember one of my friends saying this, that you are, I cannot take derma because of this. Okay, and that was the STD wala part. That okay, some people are grossed out by genitalia and all, and they don't want to see like hundreds of genitalia every day. Okay, so if you are someone who is like that, then you should consider this as a factor also, because it's not just derma, it's also venereology, and it's also leprosy. The other factor which you should know about derma is that once you will be done with your PG, there are not a lot of job options out there. Okay, so unlike radio, like people like often compare radio and derma. So in radio, when you are done with your PG, you don't have to always start your own setup. You can always join a corporate hospital. So any hospital, चाहे वो मेडिसिन का हो, सर्जरी, ऑब्स गाइनी, पीडियाट्रिक्स, एनीथिंग, any hospital would invariably need a radiologist. Okay, so there are ample number of job opportunities with really good pay scale for radiologists out there, like straight when you are done with your PG. But for dermatologists, they're not really good job options as such, so you have to start from zero, and you have to build your own brand name only, right? Government jobs are obviously always an option, but that is uniformly there for all other branches, so it doesn't really make a difference. The other con about derma is the competition it gets from the quacks. Okay, so it's not just the other medicos, but also the non-medicos who often sort of give a competition to the dermats. But I don't really believe that it's a competition. It's more of a substitution they are trying to give to the population. Okay, so till now, all I would like to say is that I am thoroughly enjoying my residency as of today. Unlike most of the first year resident doctors of any other branch, especially of the clinical branches, who would tell you कि अरे यार करती करती यहाँ पर ये branch लेके, I would very happily tell you कि I'm pretty satisfied with my decision, and it's a very good option for people like me who are like non-hustler sort of people, lay back, chill, relax sort of people. So I do hope you found this video helpful, and if you have any more questions, I'll be happy to help you out. You can always just type them in the comment section down below, and thank you, and bye bye.